We have been talking about mHealth, we have been talking about so many devices and applications. One single question is the healthcare industry in India, specifically the physicians, are they open to review the vitals of patients and mobile and prescribe medicines through that? Is there a wide range of acceptance that we can accept from the market, especially from physicians?
So the physician acceptance is, it depends. That's my quick response, but you need a much more detailed study in terms of what type of physicians, what conditions, what age groups, what specialties are more open to it. That would be my response.
Next.
Okay, to Manish Gupta. Regarding the open API system that you were defining, my question is there are a lot of stakeholders when you talk about data capturing or forwarding or processing it. So I, as a consumer for any of the devices.
Can you come closer to the mic?
Okay, I, as a patient or a consumer to the various consumer health products, for example, I personally use a Fitbit. But at the end of the day, I have to pay probably half the price of what I purchased the device to get my own data. So my question is, has there been a new definition of data ownership, and is the patient being left behind again in the open API system?
So what you're pointing, making this vision come true, in addition to the issue of charges that you're bringing up, I think a much bigger issue is privacy of data, because there are still a lot of, because of privacy concerns, there are a lot of regulations that prohibit patient data from being, for instance, from being taken beyond state boundaries and so on and being analyzed. So there's a lot of host of research challenges, at least that I see as a researcher, that have to be dealt with. For instance, a lot of work needs to be done on privacy preserving techniques so that you're able to properly anonymize the data, preserving the privacy, conforming to the various regulations and so on of the patient's identity, and be able to then use it for research purposes. And then you also need things like consent from the patient and so on. So there are a host of challenges that are still associated, which all need to be overcome. But again, as a researcher, I get excited about these challenges rather than being cowed down.
Yeah,
one more
question here, please. Sir, your product, the watch, is really very good. You were talking on the 5 Ps, but with my experience and with a bit of research in health areas, I found that Indian patient, in spite of knowing that he is hereditary, they have diabetic at home, he never gets checked up until he falls down. Even in the case of BP or any other non-communicable diseases. It does definitely matter that if a doctor tells the patient that you need a glucometer to constantly monitor your health, he definitely buys it. So in terms of your product, you were talking on urban and rural. In rural markets, you have an opinion leader, right? Now, how you wish to put your product on to the customers is most important. I just wish to know this. This is first part of it. And second part of it is, we've got a set of about 120 students, and all of them would work on this area in case you are interested.
Sure, sure.
I just wish to know how do you wish to take this product out to the market, to the target audience.
Okay. Regarding the motivation, can you please buy the product? It's basically the middle-aged group who is earning have to take care of their parents and their children. And we always send messages to them so that they go push their dad and mom saying that, Dad, did you check your vitals? And because if they don't check the vitals, they are not the ones getting the message. It's their sons and daughters. So unless you push them, the senior citizens are not going to do it. And the incentives that you are adding makes a lot of difference. And we noticed it from our experience before adding all this and after adding all this?
No, my question was, if a doctor tells it, may say, he may refute it, but if a doctor tells it, he definitely has to follow it.
Right.
Yeah, that's the kind of influence that, a patient has, or the trust that the patient has on the doctor. So I was just talking on this aspect of the psychological input that a patient trusts the doctor and goes to him, and the second part is marketing on that. Otherwise, the marketing entire philosophy becomes, myopic.
Okay.
Right.
Well, I'm getting a lot of science.
Ministry of Health regulations is acting as an impediment. I may request all of the developers, it's nice to see a lot of technology developing in the country and there's a lot of business potential, but please adhere to the standards. Because unless you adhere to standards, then when the business process starts, then I'm sorry that all these things will be coming as obstacle for you. So you have to adhere to standards.
Thank you for that comment, and with that,
Thank you, guys.
Thank you.
Just an announcement.
Initiative by Apollo Hospitals where we provide free insurance to the parents and the children. So this is a token of appreciation and thank from Healthy Schools.
The two top major objectives of healthcare providers today are to improve patient outcomes and to maximize the productivity of caregivers at the point of care. Healthcare providers are seeking to achieve more efficiency with their limited resources while trying to grow operating margins. Every year, billions of revenues are lost or put at risk due to inefficient and unsecure communications caused by the use of outdated communication systems and point solutions by nurses, physicians, and staff in the patient's circle of care. The impact of challenges resulting from inefficient and unsecure communications is manifold. Patients irritated by slow response times and noisy paging systems. Nurses under constant stress dealing with irritated patients, endless walking between rooms, and playing phone tag with on-call physicians. Physicians frustrated after returning the nurse call from their messaging service, only to find the nurse unavailable or busy with another patient. Hospital administrators annoyed by poor HCAP scores, slow decision-making, delayed patient discharge, low clinician satisfaction, and productivity and privacy violations and medical errors. To overcome these challenges, healthcare providers must implement an effective communication solution that enables those in the patient's circle of care to seamlessly communicate and collaborate. Agnity Healthcare provides Aptus Mobile Care to enable healthcare providers to overcome challenges and meet their objectives. Aptus Mobile Care is an award-winning, HIPAA-compliant, patient-centric, secure mobile contextual communication and collaboration solution that empowers clinicians wherever they are to achieve better outcomes at the point of care. By integrating secure text, voice and picture messaging, notifications, alerts and escalations, voice calling and audio-video conferencing, with contacts, availability status, calendaring, and real-time access and sharing of patient data. Mobile Care enables all members in the patient's circle of care to communicate and collaborate more efficiently and effectively. Mobile Care is simple, easy to install, use, and support, runs on popular smartphone and tablet devices, and is designed for your current and future communication needs. Brought to you by Agnity Healthcare. Anywhere point of care. It's that easy. Contact us today.
Hello, everyone, and good afternoon. I have the wonderful distinction of trying to encourage people to come in after lunch, which is always a challenge. We also have the wonderful opportunity of trying to offset your postprandial hyperemia, or in simpler language, being sleepy after you eat. This should be a very exciting session. Our speakers here come from literally around the world. What we've been able to hear in our past session is the ability to go from data to information, knowledge and insight to wisdom. The last piece is really the focus of our session, which is it's great to know something. It's a lot harder to change behavior. The big bites, or if you will, the technologies that take information and present them to the user to change behavior, is really what we're focusing on over the next hour or so. So we encourage your participation during the question and answer session. They've always been very animated. Each of our speakers will speak for approximately 10 minutes and come from a host of different perspectives, from pervasive computing, basically computing that travels with you wherever you're at, home health, cloud, and other basic information management mechanisms to make sure that information gets to you at the right place at the right time for the optimal change in behavior. So with that, I'll introduce our first we'll pass the baton to our first speaker, Mr. Mani from American Megatrends. Thank you.
Thank you, Dr. Asif. Hi, good afternoon. I know I am in Kritim. Adaram Sarva Vidyanam, Ayagriva Upasmahe, Saraswati Namastubhyam, Varde Kamarubini, Vidyarambam Karishyamin, Siddhir Bhavatu Me Sada. Good afternoon, everybody. Today, what I am going to talk about is a story. We have a villain, we have a victim, and we also have a hero. So we'll go through this story. There is a plot, and there are surprises, and I hope you will enjoy the whole thing. Okay. So let me start with the villain. The villain of the current millennia, I would say, are the silent killers. What are silent killers? Silent killers are non-communicable diseases, and it cannot be detected easily, but it is there with you all the time. One time, when they come out, just that takes the life out. So silent killers are those diseases that produce minimum or no symptoms and cause death if not treated on time. Silent killers are the main reason for many deaths that is happening across the globe. And the three major silent killers are your heart disease, hypertension, and diabetes. Okay. This is from WHO. Yesterday we had members from WHO. So this has been compiled from them. My favorite skull. So number one death, number one cause for all the deaths across the globe is heart disease, cardiovascular diseases. So around 9.4 million deaths happens each year, or 16.5% of all deaths can be attributed to high blood pressure. This also includes 51% of deaths due to strokes and 45% of death due to coronary heart disease. So about 1 in every 3 adults have high blood pressure. So high BP, as I said, has usually no symptoms. If somebody has to detect high BP, if the doctor has to detect high BP, the person should be having a BP of 140/90 on at least 3 occasions within a week. If that doesn't happen, then the person is not having high BP. Sometimes it could be because of stress. So a proper analysis and proper data capture needs to be done in order to ensure that whether the person is having high BP or not. So who are the victims? You, me, and everybody out in this world are victims to silent killers. Each and every one of us are victims of silent killers. Of course, the hero is our doctors, and more importantly, you have to do regular vital monitoring at home in order to figure out whether you are having any of these conditions in order for you to detect silent killers. So at least if there is 140/90 on more than 3 occasions within a week, definitely is an alarm. Call your doctor right away. So, which brings the interesting question. Now I'm talking about the consumer, you, me, and everybody. we are at home. We are not sophisticated healthcare professionals, but at the same time, we need to take care of our health. If we need to take care of our health, we also need to know what are the vitals that we are running with and how we will measure them easily and efficiently so that we can take care of our health. Right? So, what we do here, we know specialists, doctors, they are exceptional, they go through a degree program, they get certified, they have experience, they have practice. So no question in the specialty part. But the question is always in the device part. We have consumer grade devices and clinical grade devices. Okay, before that, this is an article published by Harvard Health Letter. It says 72% of the patients who used regular monitoring at home, they were able to safeguard themselves from silent killers. So home monitoring devices. Home monitoring devices current state. So when I talk about home monitoring devices, I'm talking about this BP meters, I'm talking about this SpO2 meters, temperature sensors, everything that is used by a typical consumer in order to check the health. Now, let us do a comparison of these home BP meters and home healthcare meter, monitoring meters, and with the clinically available device. Consumer grade devices, they lack in quality and accuracy. I'm going to share a small video right after that. You would see that consumer grade devices that is available in the market today has 60 to 70% accuracy level compared to the clinically grade available devices. Right? So let's look at this video right now. So here I have taken examples of a couple of consumer grade devices. The one that you see there is a fluke simulator that is approved by FDA, which is used for validating the devices. Fluctuation of around 15 to 20%. Look at it, 140 by 90, 152 by 88. So this is a clinically grade device. The price range is around 60,000 to 70,000 Indian rupees, and the accuracy level is around 90 to 100%. So which clearly says that consumer grade devices that is available in the market do not have the accuracy and the quality that we have with the clinical grade devices. Affordability, if you are looking at home healthcare scenario, consumer devices at home, it is going to cost 3 or 4 times more if you want to go for a clinical grade device. And most important of all, I want to point to that study there, home sphygmomanometers, validation versus accuracy. It is found 360, which is 72% out of 500 BP meters showed incorrect readings. This was a study conducted in US where they took all these consumer devices and they validated 72% of them showed incorrect devices. So as a consumer, you, me and everybody here, if we are going to rely on this data and do our checkup, are we giving the right information to our doctors to make sure our health is being taken care properly? It's a question we need to ask. So, what is the need of the hour? The need of the hour is to have home monitoring devices that is of clinical grade and accuracy, and which is also affordable. And most importantly, it should not be bulky. It should be portable. And we don't want to make every consumer here on this globe to become a healthcare professional. It should be easy to use. What are the challenges in actually making a consumer grade device that is of clinical level accuracy. Over the last 2 days, I have been listening to various presentations. And in my experience, American Megatrends, we have around 300 patents. We have been working on various hardware, software, engineering technologies. We have built the world first right controller card, several things. We had many accomplishments to back us up. In our experience, we clearly differentiate what is a prototype and what is a production level system. The challenges you would face when you are designing for a production level system, which has to be used by your consumer day in and day out without calling your 1-800 support line and having the reliable information. The first and foremost challenge is you have to understand that any vitals that we are recording, we are going to use either electronic signal methods or photometric methods. Cyanomolecular node generates current in microvolts and millivolts. As you age, the current that is going to generate is also going to decrease. So, while it is good to have a device that is working on a healthy person, you have to always consider the extreme factors of how it is going to work for an aged person, old person, having sickness and illness. That is when they are going to use the device. So, analog circuit design, photometric design. For example, SpO2, you are going to use photometric method to detect how much of oxygen level is in the blood. One important aspect that we need to understand is, like, as people age, the fingers start shivering. When the fingers start shivering, you are going to generate more noise signals. And when you are generating more noise signals, that is going to give you completely incorrect data. So due to lack of time, I'm not going to spend much more time on this particular slide. At a high level, there are several design-related challenges one need to address. And most important thing is conformance to standards. There are several standards that has been put out by AAMI, BHS, FDA, and Indian Medical Association. We have to ensure the standards are maintained, and the manufacturing process and quality should be of ISO 13845. And most importantly, the device should be affordable. What is the beauty of building a device that is so expensive that your consumers cannot use? So when you are designing a product, all these things needs to be taken into consideration in order to make a quality and effective product. With this, I conclude. American Megatrends has taken activities to develop at-home monitoring device. Wait for us, watch for us in this space. You will be seeing some announcements made by us in the next couple of months, where we have designed some devices which meets all the criteria mentioned ahead. Thank you.
Well, thank you so much, sir. Our next speaker is Ms. Ashwini Pullabhatta. She's a wireless health engineer from Case Western Reserve University, San Diego. May I please request ma'am to please come ahead.
So, hello everyone, a very good afternoon, and thank you for introducing me. So, today my talk is about wireless health, remaking of medicine by pervasive technologies. Wireless health, probably most of you might have already heard about it, but let me start by defining what wireless health is. So, wireless health is about enabling the diagnosis, the therapy, and the related health conditions. By, of course, you're going to track the relevant biomarkers, and you also have to manage your health regime, and more importantly, you have to monitor the progress. And these solutions, which have been defined as wireless health solutions, they don't intervene at all. So as Mr. Vinod Khosla rightly put it yesterday, people are here only for exceptional handling. So it's like we don't take. Most profound technologies are those that disappear. So when I say disappear, the first thing that comes to my mind is magic. my childhood magic where I see my magician who actually probably pigeons and rabbits out of my hat. So he rightly put it, like if you need a perfect solution to anything, that should be something that disappears. So wireless health solutions are as a result of convergence of 4 pervasive technologies. Because of the technological advancements that actually been happening in the digital field, we have seen a lot of changes in the way medicine is being perceived. So the 4 convergent technologies that I would like to talk about, the first one is ubiquitous sensing. A simple example is my best friend and probably I call it my baby, that's my cell phone, my smartphone. Probably if I would have spoken to my grandmom and if I told her that, cell phone is something that I only talk to you, but beyond that, I also do my health monitoring. She would be surprised, but definitely not my kid who would grow up in 20 years. He would say, yeah, that's pass. So ubiquitous sensing is evolving, and we should appreciate the fact that the evolution is happening in a very rapid way. And seeing Dr. Vinod Khosla's presentation yesterday, where he clearly showed us that a cell phone, which could be used for an eye examination, a cell phone which helps a pregnant mom monitor her 9 months of pregnant duration, a cell phone which would help probably a caregiver take care of a diabetic patient. So it's the power that's in your hand. And cloud computing, before I start that, wireless connectivity, of course, all of us have already been talking about it. But again, I'm going to cite my grandmom's example. I would probably tell her that I'm walking to a coffee shop, and you know what? I'm actually going to improve my health. So she might be quite alarmed. Coffee, and you're going to improve your health? But what she doesn't know is I'm actually going to use my cell phone to sync with my Fitbit, which I actually don't wear. I'm not wearing it right now. I'm going to sync my Fitbit through the wireless connectivity available probably in the coffee shop. And of course, the next one is cloud computing, which probably the next speaker will be talking about. But simply, I want to put it that it's a commodity. You just pay for it. You have to appreciate the fact that it's being available to us at such free, I should say it's like, you don't even know that it exists. And finally, the 4th technology is the most famous, and of course, the quite notorious social networking. Ms. Srinidhi Chidambaran and Ms. Pam Yoder have actually explained about how social networking is infiltrating and how we need to start appreciating the fact that it's beyond socializing and networking. So we at Case Western Reserve University have taken up a new research project which would help us to evaluate the senior population and their interest and probably motivation in using social networking sites, not only Facebook and Twitter, but simple probably emailing and messaging in a cross-generational format. For example, one of my students from the research lab would send in like 5 or 6 messages a day to a senior to probably stand up and start walking. This is a simple example, but in future, we could see much more. So social networking, even though it's like more, we only see Facebook and Twitter, but it's way beyond that. So as a result of all these technologies, we have seen a definition change of what we perceive healthcare as. So for example, the healthcare which was only available to a particular setting like a hospital or a clinic is now available anywhere. And then appointment-based is like any time. For example, if my kid is running a temperature, then I would probably not wait till tomorrow morning till the pediatrician's office opens up. I would just go onto the portal and book an appointment. So it's like any time and anywhere. And then, as rightly one of the speakers also mentioned, from reactive medicine, we are actually progressing to a preventative medicine. And the solutions that have been coming up in this digital world are really helping out in this field. And of course, we have seen a lot of technological inefficiencies probably 20 years ago, or let me say 50 years ago. There was absolutely no technology to help us to probably discuss health with the other population. But today, these inefficiencies are being converted to a more usable technologies by defining what pervasive technologies are. So beyond all these discussions, we all are here to discuss what's the big opportunity. The big opportunity in this field is the ubiquitous computing and connectivity. Mr. Stevens Yo mentioned it yesterday, that there is an opportunity associated with it in terms of cost, in terms of quality of care, in terms of convenience, and in terms of reach. The definitions might be different if you're talking about an industrialized country or if you're talking about a transitioning country like India or Mexico. But the opportunities exist. Now, the big opportunity, that is the computing and connectivity, have actually kind of given us a roller skates. Or let me say, we are actually sitting in a Ferrari, wherein you are literally able to shop, you're able to talk, you're able to network, you're able to socialize, you're able to watch a movie, you're able to talk to your parents who are probably 11,000 miles away from where you stay. So it's like defining the new era of mobility. Now, what happens when this mobility infiltrates healthcare, and it has infiltrated? That is the reason we all are sitting here discussing it. If it infiltrates, it's going to actually pay off very well. Finally, where is this big opportunity? So I'm talking about, as I have already mentioned, I'm talking about both the ends of the developmental spectrum, both the industrialized countries and the transitioning countries or developing countries. But what we need to understand is, since we are here in India, transitioning countries are actually being faced upon with a double burden of disease. Let me take an example of India. So we already have a burden of disease like infectious diseases, and then we have malnutrition and poor public care or the sanity. But on top of that, because of a transition in the way the population, the health behaviors, the population's health behavior, they're urbanizing. So now, I would probably, if I'm talking to teenagers, they would say, you know what, I only have burgers for my lunch and dinner. So definitely we see obesity, which is, I see obesity in probably the next 5 years, which wasn't existing probably 20 years ago. So India, transitioning countries like India needs to rethink how the wireless infrastructures are being defined to address such conditions. And not only the transitioning countries, I'm also talking about the industrialized countries. So definitely we all together have to sit here and then work towards a new infrastructure. And just to close upon, because I'm running out of time, Dr. Gopalan actually mentioned yesterday, geeks versus darks. But I'm glad that universities, probably in United States and in India and in other countries, are putting a step forward in actually bridging the gap between the geeks versus darks. Because we don't want it to be a war or I'm against you or you're against me. We work together. And universities like Case Western Reserve universities are defining new graduate programs to help bridge this program. Bridge the gap, sorry. Thank you very much.
Around India, with more than 18 years of public and private healthcare experience and more than 8 years in Microsoft. His background includes IT training, psychometrics, testing, skill development, and initiatives. He's here to talk to us about the pervasive technology of cloud computing.
I'm not going to start off with a prayer, though. I did start off with a silent prayer in my heart, saying that I hope I can keep this as interesting as the earlier speakers. What I'm going to talk to you about today is the role that cloud computing can play in healthcare. And before I start off, I wanted to explain to you why the choice of this topic. There are multiple healthcare imperatives, that is ahead of us. We're talking about better access. We are talking about better patient experience. We are talking about better healthcare delivery. And we are talking about all of this in an attempt to lower costs. And I truly believe that cloud computing is something that can help us achieve these imperatives. And that's the reason why I've chosen this as a topic for today, and let me explain why. The earlier, imperative, IT imperative, was that of, consolidate and reduce costs, and that's changing today. The imperative today is, how can IT help me transform what I'm doing today? How can cloud computing help me transform healthcare delivery today? And that's something that I'm here to talk about. Just to take a step back, what is cloud computing? It's an on-demand delivery of compute services, fairly as a standardized, IT service. And what it hinges on are pretty much, 4 inherent characteristics. And these characteristics lend themselves very well in terms of what we are looking at from a healthcare perspective. The first characteristic is that of pooled services. Now, pooled services is that much more than just talking about virtualization. What it is talking about is the ability to dynamically provide compute services the way they want it on demand. The other aspect which is there is that of the ability for business to be able to avail computing services in a self-service kind of a manner. What I mean about this is that imagine the marketing part of a hospital wanting to launch a campaign, and which means that there is going to be a spurt that's going to be there in terms of the compute services that's going to be required for that. Now, is this something that can be availed as a self-service kind of way? We believe through cloud computing it can happen. The other 2 areas that are there are, I think, even more significant from a healthcare perspective, and very significant from a public health perspective as well, which is the elasticity that cloud computing can offer. What I mean by that, take, for example, a natural disaster. Take, for example, what may have happened at Uttarakhand. What you would need is, you would need compute services to be able to grow at rapid pace, to be able to cater to something like that, to something of that scale and size. And then, after you've been able to contain that, you don't need those compute services anymore. It should be able to come back and be available to you the next time you want to use it. That is the elasticity that cloud computing can go ahead and provide. The other is in terms of, the other characteristic of cloud is in terms of usage-based. I pay for it for computing services, as per how much I use. This is a classic example of, let's say that, somebody were to start off with 5 clinics, I then want to add on more, and then I want to grow rapidly. How do you provision for IT for a scenario like this? So what we're talking about is that I'm going to use compute services in the manner in which I want it to scale, the manner in which I want my business to scale. And that lends itself extremely well to the way that hospitals or healthcare entities can go ahead and leverage IT. So what this typically does is that the benefit of doing something like this is it is increasing the flexibility and agility with which we're able to go forward, the way that we are able to deliver care, the way we are able to launch probably marketing campaigns, the way we are able to scale up, the way we are able to respond to natural disasters, disaster recovery, and so on and so forth. Now, what I have looked to do is I have looked to identify some of the top areas where we are seeing scenarios where we are seeing that cloud computing is going ahead and impacting today. The first one being enterprise image archiving. Hospitals today, go ahead and generate more data than probably any other industry. You have structured data, you have unstructured data, you have data coming in the form of DICOM images, you have scanned images, and whatnot. Look at how is it that, this is something that you have an option for archiving that is available either by virtue of a medical legal requirement that may be there or by virtue of a business requirement that may be there. The medical legal requirement apart, from a business requirement perspective, cloud allows you to go ahead and have an archiving which is there in the cloud, and which then means that your entire radiologists are people that can be located in one single place. And that lends itself very well. The other is in terms of disaster recovery. Can I go ahead and make all my radiology reports available on cloud and give that to patients to access it the way they want it, the way they choose it? I don't have to cut a CD and then give it to them. So these are ways in which, from an enterprise image archiving perspective, cloud is adding value. The next one is about storage and analytics. We all know that data is stored in different parts of the hospital. There is data stored in different branches of the hospital. There is data in different health systems which are there across multiple hospitals. Now, this does not provide for analytics. Imagine a scenario where you're talking about the data that may be there in multiple diagnostic labs across the country. If this were data that were available to us aggregated on the cloud, it would render itself very well for analytics. What that means is that you can see patterns, you can see where there is, you'll probably be able to call out trends, you'll be able to call out the areas where there may be a possibility of an epidemic breakout or a pandemic breakout. And that is something that cloud computing can go ahead and do. I spoke of disaster recovery already. And the other thing that is in terms of not just management of disaster recovery, it is also the fact that if data in terms of electronic medical records, patient data was stored on premise, and this does not lend itself very well to the data getting wiped out in the case of a natural disaster. Take tsunami hitting Japan. And something that they realized is that if this data were available on the cloud, then getting back to normalcy is going to be that much more easier. The other two areas is in terms of collaboration, again, in terms of if you'd want to, let's say, set up a H1N1 response center, how is it that you can scale it up? How can you make sure that information dissemination and the other thing, and training and all of the other areas that you'd want to do is something that can be scaled up to the speed at which you want it to go? Cloud computing can support easier collaboration or rapid collaboration. The fifth area that's there is in terms of clinical groupware and EMR. Picture EMR as not as something which is an enterprise-wide IT service which is there, but picture it as an on-demand service. Now, hospitals, larger ones, can afford to have IT teams that take care of IT there, but picture how it is going to be for smaller hospitals, clinics, an individual physician wanting to probably have modular service of an EMR. Cloud computing lends itself extremely well to those scenarios. When you talk about cloud computing, the different areas that come to mind is in terms of this, is in terms of what's the kind of security of data that is available. What about patient privacy? How is it compliance to standards? What are the business processes that are there by my cloud service provider, which I should be aware of? Now, these are areas that I think to a large extent have already been crossed. We've gone beyond this threshold, but it's important for you to view it from this perspective. When we talk about cloud, we are not essentially saying that move all the data that you have to the cloud, all your IT applications to the cloud, though there are those who are doing it as well. What we are talking about essentially is that look at cloud on a continuum basis. Think of it as a continuum that goes from on-premise to cloud to public cloud. There are multiple apps that work within the healthcare system. What you can choose to do is to keep something that is really relevant from the perspective on-premise, and the ones that render themselves to a cloud or a public cloud, move that there. So I just want to close with an illustration of how you can afford to look at and define your cloud strategy the way you would want it to be. So patient administration, it's probably too costly to run myself, but I've made too much customization. I'd want to keep it as a private cloud. I want to probably move my anti-malware and email onto the public cloud. I don't want to have servers in-house, me managing it, handling uptime, and all of that. I would probably want to move it. Now, so here I'm demonstrating for you how the decision of cloud is not about saying that, am I going to move entirely to the cloud? And that's not the suggestion at all. The suggestion is, look at what is it that you have as your imperatives and decide for yourself, what is it that I'm going to have on this continuum? So with that, I'd like to wish you a very good journey to the cloud. Thank you very much.
Thank you very much. I'm going to go next, and I invite you to the podium. Just for those that are in the room, Google Analytics is telling us we've got about 3,541 individuals that are online and hanging out with us. So it's great to be not only here in Hyderabad, but around the world at this wonderful conference. Ken Epps is the president and CEO of Agnity Healthcare. He is advancing the company's mission to deliver a patient-centric communication solution to empower the circle of care, to improve access and enhance the quality of healthcare. In the past, Mr. Epps took two venture-backed software and services company, Bay Packets and Emerald Solutions, from concept creation to revenue. He's launched numerous customer enterprise communication solutions with leadership roles at AT&T, Williams, Emerald Solutions, and Bay Packets. I thank you, Ken, for both your flexibility and your presence here.
Thank you, Asif. A good joke that I had cooked up when I realized I was last on the agenda, and I think Yasif must have heard a little bit of my joke and decided to move me up so you wouldn't be subject to it. So you missed my joke today for that purpose. But I'm happy to be here to talk about mobile-based contextual multimedia conferencing solution, because I think that there are some great opportunities for healthcare to be enabled with these type of solutions. I have a 17-year-old son, as I'm sure many of you in the audience have kids, and if you have teenagers, you relate to this. He's an avid game player. He loves video games, but his favorite video game is an American football video game called Madden Football. And John Madden is a famous American football coach who's retired, and they're leveraging his name. But the interesting thing about the game is how long he can play it, how he enjoys it, how he gets connected in the game, and he plays with other kids all around the world. And of course, he gets into a lot of trouble with me because he spends too much time doing it. But the thing that fascinates me about it is, what is it that keeps his attention? And how can he spend hours and hours and hours and hours on this game and just love doing it? And what I came to realize was the game does a fantastic job of simulating what he sees as a real life experience. It makes him feel like he's in the stadium, at the football game, watching it with his friends, watching the players, being able to, in his own mind, imagine what plays that they want to run next, be able to talk back and forth as he's sitting there. And as I looked at that, and as I think about that as it relates to healthcare, and some of the challenges that we certainly have had in healthcare for adoption rates and uptakes and getting the physician community to use the services, I came to realize that if you can make something to really simulate the experiences that someone is going to have, then that person is going to enjoy and they are going to use the service. They are going to use it. And so in healthcare, I think there's a wonderful opportunity through multimedia conferencing to provide a solution that will simulate the way that physicians conduct their business, the way that they conduct their relationships with their patient, the way they conduct their relationships with each other. And to the extent that that can be done, the adoption of telemedicine, mobile health, and these types of solutions that are device-driven will be high. To the extent that it can't be done, I think there will always be challenges getting these things to be adopted and used in the physician community. One of the more important things, and because if you think about it, clearly physicians, and I'm sure there are a lot of physicians in this room, they by no means are alike, they by no means are kids, but they have some similar traits in the sense that if they don't like the toys, they're not going to play with them. So if you put things in front of them that might be interesting for the technology team, but the physician team doesn't find it useful, doesn't help them in a way that they see immediate benefits, it'll just sit in the corner, it'll never be used. And so what I believe from the telemedicine standpoint is that context, and what we refer to as contextual communication, and contextual communication by way of video conferencing, has the ability to bring these type of capabilities into use from a physician standpoint. If you think about it, most of us have seen physicians, and if you're a physician in the room, you have relationships with patients, you have relationships with each other. The most important thing for you to do is to have technology that will enable you to be able to have the virtual experience that you're having with your patients and from your facility. So having contextual type communications now that would enable a physician to be connected to a patient, that patient to have the tools and the capabilities to communicate with that physician in a way to where they can have that distance type relationship, and that physician would have the tools available to them, all the way from the visual capabilities to communicate with the patient, to access to that patient's information or those records that are important for that patient, to having information that might be pulled from various types of measurements that are utilized with that patient, whether it's EKG type information or whether it's monitoring devices, basic medical type devices. That will be a very, very powerful thing. And if that can be delivered and can be delivered on the tools that are used, and it doesn't require any brain drain from the physician community, they will use it because it's beneficial and it helps them in their lives. And I believe in what we believe from a telemedicine standpoint is that mobile and video type capabilities can enable these types of things. What are the capabilities that are important for doing that? A number of things are. Secure messaging type capabilities are important because clearly you want to have the ability to secure in a confidential way. Access to patient information is going to be very important. You want to know what the latest situation is with the patient that you're dealing with, voice routing kind of capabilities, of knowing where someone is, if they're available, if you need to consult with someone around the patient, there's a lot of capabilities from a technology standpoint that's pretty important for enabling that. When that integrated technology is there and that capability is enabled, then there are enormous workflow benefits. There's enormous workflow benefits associated. Going back to the chart. There's enormous workflow benefits associated with doing it. Those benefits range all the way from being able to access information, as we talked about. They range all the way from being able to consult, have clinician consult, being able to stand up video communications and conferencing so you can have a visual relationship, being able to find and locate important people that you need to communicate with relative to that patient. And contextual communications, which is information or as we like to say, smart communications and informed type of messaging, informed type of voice, informed type of video communication will enable this. The other element that's pretty important is the healthcare delivery organization must have a proven delivery method for the mobile technologies and the mobile capabilities we're speaking of. That proven technology will involve two things. One, it has to have the highly used, the highly scalable communication tools that people use every day. Texting, voice messaging, video capabilities. But that has to be married with health information technology information, access to patient records, access to lab reports, access to monitoring tools, and these type of capabilities. When those two things are married together and they are integrated from a technology standpoint, then healthcare delivery organizations will have the capabilities to deliver the type of solutions that physicians and clinicians will find useful and that they would feel gives them a real life experience similar to what and how they do their business today. Now, the most important piece, and I'll close with this, is, and I'll reference here a Gartner 2013 hype, cycle of telemedicine hype. All of us in the room can come up with tons and tons of reasons why a technology won't be successful. I mean, I've been in telecommunications for a long time. I can tell you many, many stories about telemedicine and how many times it's gotten started, it stopped, it did not succeed. Certainly today, there are all kinds of reasons from bandwidth restrictions to the type of devices that people have, to regulations, to payment models. There are all types of things. But the most important thing is to have the capabilities that succeed the hypes, go through these 5 stages here in the cycle that's described by Gartner, and eventually reach the plateau or reach what they refer to as the plateau of productivity. And what that means is the technology has gone through the hype, it's gone through the starts and stops, it's gone through the situations where it looks like it might have been wildly successful in the beginning, and then of course it didn't meet expectations, and there were periods where it looked like it would not be successful, but it turned out to deliver the results, deliver the operational performance, and deliver a model that would enable it to be used by the clinicians and the healthcare population. So if you do those types of things, we believe, at least from our perspective, that solutions can be put in place that will deliver real value to clinicians from a telemedicine standpoint. Thank you.
Not to really impede upon one's natural workflow. In fact, the best technologies we just heard are those that you don't see. He's also demonstrated the importance of data dictionaries. We heard about data dictionaries earlier with our 3M colleagues. So football in the United States may not be football here, right? So data dictionaries continue to become important, both in real life as well as in healthcare. So we're going to have our last speaker for this session and panel. Mr. J.S. Bhatia will be next, who's Executive Director of CDAC. He is one of the most well-known personalities in the telemedicine industry in India. He has led the development of e-health solutions at CDAC and has been the chief investigator for prestigious projects in telemedicine and cybersecurity. He has 20 publications to his credit and serves as an expert on the decision-making and policy-making boards of several governmental agencies in and around the state of Punjab. I welcome him and your comments.
I'm privileged that I'm the last speaker of this conference also. I will talk about the government from government perspective. This National Optical Fiber Network has been discussed on day one at a length. This is a wonderful project of Government of India, connecting 250,000 panchayats of government, Indian territory with fiber optics. The bandwidth will be 10 Mbps to 100 Mbps. There are a good number of applications which will be hosted. And definitely, e-health has its own chunk in that. And most of us who are in the think tank of implementing e-health are aggressively thinking on this, how to do it. In the first phase, this is the services offered will be G2C, B2B, B2C, P2P, covering e-health, e-education, e-agriculture. It's unlimited. You come with the new application, there is a solution. If available, NOFN is open to you. Government is ready, under e-governance, they are ready that any application which comes to them, they are going to implement, which can benefit the rural people, the people who are unreachable. Then filling the prevailing connectivity gap. Now, fiber optics is up to district and district to block, and that's all. But now from blocks, it is going up to panchayats. And panchayat normally covers 2 to 3 villages in average, that is. So the purpose is to empower the people of the rural area where nothing is available. They have to walk, even transport is not available. They have to walk a lot. There are areas in Himachal, Uttarakhand, similarly around India, that is there. You have to walk. You cannot even, I give you the example, there are some places in Himachal where my team implemented the telemedicine. They have to carry system and medical equipment loaded on the people and horses from one place to that place and implemented, and that made it functional. That is what is there, and that is through different kind of connectivity like VPN and others. But once this is connected, it will be definitely going to benefit those people. This is e-health pilot using. There are 3 places which have been allotted to us, asked us to implement it so that the pilot can be seen how it is working. So 6 hospitals were connected. One was Primary Health Center, Fatehgarh in Ajmer, then Community Health Center, Panisagar, North Tripura, Primary Health Center, Wada, and Vizag, Andhra Pradesh. These are the main places where telemedicine or teleconsultation is required. And it is being provided from GLN Medical College, Ajmer, GB Pant Hospital, Agartala, and King George Hospital, Visakhapatnam. So they are connected. And the last one is to control it and to know the output. The NIC center at New Delhi is connected. So these 7 centers are there. The medical equipment is only at the 3 centers which are at remote sites. Others have the equipment and they don't need the equipment because equipment is required where the patient is, like BP meter, scanners are required. ECG is required. These are the primary things which are required, and they are interfaced. Say ECG is directly interfaced with the software called eSanjeevani, which is a product of CDEC. This is the Government of India. So that product is implemented at these places, and it is functional. And this total 7 sites, no doubt they are spread in the corners of India, were completed within the 40 days, and they were made functional. Now the connectivity is there, they are functional. On the trial basis, this is pilot network on NFN. These are the states and these are the hospitals where this connectivity is there. Connectivity is provided by, under the NFN by the government, and these software is installed by us. This is already working on the cloud, from where it is being assessed by the others. Around on trial basis, I think more than 20 cases. These are the where we have put up the these centers. This is Fatehgarh, and the best point is we have trained the people over there on site, so that there's no need to send the people from here to run it. There are people who are in hospitals or primary hospitals. They have been trained how to use it. This is Ajmer. These are the sites. Telemedicine Vibhag. This is telemedicine centers. Name is there. And these are the sites where it is functional. This is the person with cap is our person who has installed, remained there for 10 days, trained the people, made it functional, and then came back. Now it is functional. This is Pani Sagar. This is also in the similar manner we have installed. This is GB Pant Hospital, Agartala. This is doctors having look at the telemedicine software. This is Vizag. This is scanner, ECG, everything is, and printers are there. So in the pilot telemedicine, using enough of barriers implementation. So we need more due to the issues related to national policy is required, administrative structure, management and physician. But out of these, the best, I will say, the one point which is very, very important is the availability of physician. Because pilots, normally we put not for the technology purpose. We put these pilots for the need of the patient. These pilots are because patients need it, that's why they are there. Once success is there, then we will see how to make it more functional and more technology to put. So physicians are normally is a basic point, that because when we go to the physicians or doctors, they say we have already a load of hospital. We cannot spare too much of the time. But in certain cases, some doctors have been fully employed for this purpose to this. This is what the model we propose. We have implemented the similar type of project in Punjab. Whole state, 24 centers are there. And in PGI Chandigarh, from where they are getting the consultation, 3 doctors' salary is paid by the state government, and they are deployed only for telemedicine consultation right there. They get the problem, if it is solved by them, fine. Otherwise, they will go to the expert and consult with them and give the feedback. And that model is the most successful model over there and is functional from last 3 years. Now, less due to the commonly perceived barriers related to cost and cost effectiveness. Yes, government policies, I'm nobody to criticize that, but if I look at the government policy, government spends a lot of money on healthcare. Primary health centers, a lot of money is being spent, salaries of doctors, other things. A good chunk of our GDP is spent on health. But we are not ready to spare even 5 to 10% of that for telemedicine or e-health. That is what I'm talking to most of the healthcare doctors that it should be. So this is another project in Ajmer, e-Panchayat. This has been implemented and it is also very successful. It is also seen by Obama, president of USA's team. It was visited also, they visited also and they have seen this project there. It is very successful. It is working like anything. These are the snapshots of that. This is ECG. This is the result of that. And this